This program will present techniques for the administration of topical medications, suppositories, and inhalants. Not only do patients depend on nurses to administer medications competently and effectively, they also depend on nurses to administer medications safely. The nurse is the last line of defense to protect a patient against a medication error due to the wrong drugs, the wrong dosages, the wrong times, the wrong routes of administration, or the wrong documentation. Topical medications, including creams, foams, ointments, solutions, and lotions, are directly applied to the skin or mucous membranes. Topical medication may be prescribed to bring about a therapeutic local response, but often topical medication is prescribed for its systemic response by absorption through the percutaneous tissues. A local effect, such as cessation of itching or decreasing an inflammatory condition, are examples of a topical substance prescribed for its local effect. Drugs such as analgesics, hormones, and vasodilators are examples of topical medications used to bring about systemic effects. These latter examples are usually applied in the form of transdermal discs or patches. Before administering any topical medication, the nurse should don protective gloves. This practice ensures that the nurse's skin does not come in direct contact with the medication, thus avoiding a possibly unwelcome dose of the medication. Lotions may be protective, drying, or soothing, or may be prescribed to relieve itching and are often used to treat skin lesions. Lotions are not routinely washed off between applications. A cream is an emulsion of oil and water in a semi-solid form. It lubricates the skin and retards loss of moisture. Creams are applied easily and usually are cosmetically acceptable to the patient. An ointment is a greasy semi-solid suspension of oil and water, commonly referred to as a salve or an unguent. An ointment retards water loss and protects the skin. Ointments are used to treat chronic and localized skin lesions. A paste is a semi-solid preparation, thicker and stiffer than ointment, that causes it to be absorbed through the skin more slowly than an ointment. A paste also repels external moisture.
Okay, so the doctor prescribes some medication to take care of your arm. Can I see that? Okay, I'll clean it up and I'll put some medication on it. Okay?
Provide patient privacy, perform hand hygiene, and don gloves. Before applying a topical medication, the nurse carefully assesses the area. The skin surface is gently cleansed using an applicator or sterile gauze pad. The medication is applied sparingly to the affected area only. After any topical treatment has been applied, the nurse should assess the patient frequently for any adverse reactions, such as redness, swelling, or itching.